I'd like to start by acknowledging the traditional owners of the land on which we're meeting, the Gadigal people of the Eora Nation, and extend that acknowledgement and respect to elders past, present and emerging, and any Aboriginal people who are joining us for today's conversation. As Priscilla said, my name's Rose. I'm the new Minister for Mental Health and all of those other things. And it seems like a long list, obviously, but as we know, the intersection between a number of those things, in particularly mental health, housing, homelessness and youth, is very powerful. So whilst it's a lot of words, the space that is occupied by those portfolios is one that is very rounded and really drives me when we're talking about mental health to ensure that we're not just having a very clinical response, that we're actually looking at some of those social drivers of poor mental health. And so that's reflected in my portfolio work, but also in all of the work that you do. Your role is incredibly important as advocates to ensuring that that holistic response is one that we're leading. I'd also like to acknowledge the people in the room with lived experience of mental illness, and as Priscilla said, that's largely everyone in this room. I do that particularly because in my experience as a politician, when I think about what actually makes change, what actually persuades people to look at an issue differently, what actually changes minds, it's not really facts and statistics and that kind of heavy research. All of that stuff is obviously incredibly important. We have to be evidence-based in our decision-making. We have to be driven by facts. We have to be driven by the statistics. But really what changes minds, when I've seen people open their eyes to a new perspective, when I've seen people being willing to acknowledge maybe I hadn't understood something properly in the past and now I can see it differently, it's the power of stories and lived experience that really makes change. That's my experience. And so if we approach an issue like mental health just on statistics, just on facts, just on heavy research, we're actually not going to make the change that we need to address that issue better in society. The only way that we're going to make that change is by people speaking their truth and sharing their lived experience. And so that's why I think forums such as this are so incredibly important, and the people in this room are such incredibly important partners in the work that we have to do. Now, I'm sorry I can't stay for a very long time this morning. Parliament is sitting today, so I have to get back to Parliament House. But I want to say a few words, and I'm happy to answer a few questions as well if there's any, or if there's time for that. Look, I think in a way what I just wanted to say is I acknowledge that there is a lot of work that we have to do. Priscilla talked in her opening remarks about some of the things that Being have put on our agenda, and I do acknowledge their advocacy. And in my very first meeting with Being, they put all of those issues that Priscilla mentioned in her speech on our agenda too. That advocacy is incredibly important. There will be an opportunity through a parliamentary inquiry in the later half of this year to really look at some of those issues. We're going to launch a parliamentary inquiry, particularly into community mental health, and I invite submissions from across the board. I know that the relationship between the New South Wales Police and people with experiences of mental health will form a significant part of that inquiry. I know that the experience that people have in our community mental health settings, the good, the bad and the ugly, will form part of that inquiry. And it's a fantastic opportunity to give the new Parliament, and particularly some of the new members of Parliament who are incredible advocates for doing better on mental health, an opportunity to hear from your stories and your expertise. So that's already a response that we are making to some of the issues that Priscilla has raised, an opportunity for people to put those issues in a more formal way on the agenda of Parliament. So acknowledging that we have to do better, acknowledging that the system is not working well is an important first step. Providing opportunities for that dialogue about, okay, well, you've acknowledged that we need to do better. Where is the opportunity for us to talk in a proper way about how to make that change? The parliamentary inquiry is certainly one of those opportunities. But there will be many others where I hope to provide a chance to have dialogue about the things that people want to see change in the system, the things that we're doing well and the things that we're not doing well. In particular, I want to let you know that the role of the sort of peer worker space is incredibly important to me. I think there's two things that I really want to let you know about the way that I see that incredible contribution being made. It's very important that we acknowledge how central and significant peer workers are to making a significant change in mental health. There is absolutely no doubt in my mind that without a functioning and properly supported peer worker network, we aren't going to make any significant gains when it comes to improving mental well-being in the community. So acknowledging that and giving adequate status and support to that role is incredibly important. On the flip side, it's also incredibly important that we don't put the weight of the entire mental health system on your shoulders and say, oh, well, we have these amazing peer workers who do an incredible job and are critical links in our system, and all of those things are true, and so we'll just leave it to them. And so they can be the ones that have to resolve all of the challenges and deal with all of the issues and the inadequate resourcing and all of the things that are wrong with the system, just to put that weight on your shoulders. We can't do that either. And so we've got to find that balance of lifting you up, giving you that status, giving you that support, linking you in that incredibly important way. That chain is broken if you aren't there, but also not just saying, oh, well, we have these amazing people, and then the system steps back and says, oh, well, problem solved, surely. So that's the sort of balance that I hope to create with you, where we make a space for your work, but also we support it and adequately resource it. There's a couple of things that we are doing to try and make that work. You know, the New South Wales Health is supporting a range of scholarships to try and support peer workers. There's a particular piece of work that's happening with Aboriginal peer workers, which I think is incredibly important, to carve out a dedicated space for that group. I think that's incredibly important work. More intentional peer support training, I think that's a really important step. So there are some things that are happening that are good, but I readily acknowledge that there is definitely more work that needs to be done. And in a way, I acknowledge that through the, you know, again, the story of someone that I met up in the Northern Rivers, because as you can see, I'm the Minister for the North Coast as well. And I mean, when we talk about the incredible work peer workers are doing, I mean, how can we not acknowledge all of the work that, you know, you have had to do with the pandemic and its lingering effects, and bushfires and floods. I mean, those, on top of the already pre-existing mental health issues that we've had in our community, all of that additional work as well has been very profound and very significant for a lot of people in this room and a lot of others in the community, and that has to be acknowledged and called out as well, because there have been some really particular and acute traumatic events that have made the situation that we're facing in our society even more febrile and difficult. But as part of one of my recent trips to the North Coast, I went to one of the safe havens in Mullumbimby, and I think, you know, many people will be familiar with those types of models. They're really positive, they're really good, a non-clinical space that, you know, no need for a referral, no need for an appointment, they're free, you walk in, they can be really positive. And I went to one in Mullumbimby and I met Darren, and Darren had 2 previous suicide attempts and had struggled with his mental health for a long time, had approached the safe haven there without really knowing what to expect, just needing a bit of extra support, had really connected with some other peer workers who were in that space. And as part of his journey in recovery, when I met him, he was doing a certificate for in peer worker support at the safe haven. He was using the computers there, he was using the resources there, and he told me that that opportunity that place had provided him, both in terms of that initial connection with someone who understood what he was going through and could get him out of a very dark place, but not just stopping there, but continuing that journey to say there's opportunities for you to do this work as well. And he was incredibly excited about that and was really looking forward to completing that work and, you know, having an opportunity to support other people. So I think, to me, as I said, it's just one story. Everyone's got their own journey. Everyone's got their own lived experience. But it was an example of, in a small way, how the system is working well. Someone who was able to access support in a very straightforward way, got good support, and then was able to continue on a journey to give back. But also a reminder that, well, that's just one safe haven in Mullumbimby. They're not everywhere. That kind of support, that kind of journey isn't available to enough people. So it was an example of where we're doing well, but also the limitations of the current system. So in a way, I really wanted to turn up today to say we acknowledge your work, we acknowledge there's more to do, we want to partner with you to make the system better. We've already put in place a couple of opportunities to do that. There will be more, and really looking forward to what we can, to the stories that we can share together to ensure that the system that we are providing in New South Wales is providing that universal world-class health that, look, Australians aspire to universal healthcare. We tell a story of ourselves that it doesn't matter how much money you have or where you come from, you can access quality healthcare in this country. We know that that's not true, and we know that that's not true most particularly in the area of mental health. If there is one area where the disparity between people who have resources and people who don't is most profound, it is in mental health, and that's not acceptable. It's not acceptable to me that the quality of the healthcare that you receive when you're experiencing mental illness is based so significantly on your capacity to pay for it. So that is something that, we together have to work to break down and do better on, and think the dynamic between the peer workforce and the New South Wales government is an incredibly important link in making a change in that area. So thanks for having me.